This little blue pill is called Viagra, also known as Sildenafil. In this video, I'll cover 5 things to avoid when you're taking it. If you're new here, my name is Dr. Khalid. I'm a family doctor from London, and by the end of this video, we're going to get to the hard truths. Get it? Hard because of... These were Skittles, by the way, so demonstration purposes only. Okay, so the first important thing to avoid with Viagra are nitrate medications. These are medications that some people take for heart problems like angina. So these include nitroglycerin, isosorbide mononitrate, and dinitrate, and some medications that you would put under your tongue. The problem with combining Viagra with these medications is that they both relax the cells in your blood vessels. And when your blood vessels expand, your blood pressure can drop. And this doubling effect can lead to a sudden drop in your blood pressure, which can make you feel very unwell and could risk your health. Number 2 may sound obvious, but avoiding recreational drugs. Great, a doctor telling you not to do drugs. In particular, amyl nitrite, which is also known as poppers. These can cause the same sudden drop in your blood pressure. And for other recreational drugs, well, the thing is they haven't really been tested. You can't really, in a lab situation, be like, I'm going to test Viagra and, I don't know, cocaine, and get that through the ethics community. So you don't really know the safety of combining these things, and if you want to be safe, I would say just don't do them together. And when it comes to alcohol, while it's not a hard no, alcohol can cause erectile dysfunction in itself, and it reduces the overall effectiveness of Viagra. So if you're taking Viagra for ED, maybe don't drink so much alcohol. Number 3 is to be cautious if you are taking alpha-blockers, so tamsulosin or flomax. Here are a list of other ones, but people are generally on these medications if they're having problems urinating or if they have an enlargement of their prostate. The key thing here is to make sure your doctor knows that you're taking Viagra, especially if you're buying it over the counter from the pharmacy. And some would suggest maybe leaving a gap of 6 hours between the 2 medications. And certainly if you've just started one of these medications, you would want to be stabilized on it first before starting Viagra. And the reason for this is you want to avoid any kind of side effects or feeling unwell on them. Number 4 is don't eat grapefruit or drink grapefruit juice. It's a bit random, but these fruits are processed through the liver in a similar way that Viagra is, and it can slow down the Viagra levels being taken out of your body. So Viagra levels are higher in your body. Great news? Well, not really, because you're more likely to get the side effects of headaches, flushing, low blood pressure, and at a time where you're maybe trying the hanky-panky or having a good evening. So generally speaking, yeah, if grapefruit juice is on the menu, maybe stay away from it. Number 5 are certain antibiotics and antifungal medications. If you have a fungal toenail infection, your doctor may give you fluconazole or itraconazole. And if you have a chest infection, you might be given clarithromycin or erythromycin. These medications impact the liver's ability to process Viagra, and this can change the levels to unexpected levels. So it's super important to let your doctor know that you're on Viagra if they're starting you on these medications. And the other important thing is that if you have liver problems or kidney problems, it's important that you check in with your healthcare provider to see what level of Viagra is right for you. Sometimes with those problems, they may have to give you a lower level that is safer for your kidneys or your liver. And if you found this video useful, I would suggest having a look at this video in which I cover the most worrying men's health problems, everything from erectile dysfunction to testicular problems. Thank you and see you on there.